Dr. Jodie. Like most veterinarians, I grew up with animals. I attended a conventional veterinary school in Wisconsin. Like my colleagues, I studied hard to learn all we needed to graduate and to become effective veterinarians. We learned how to perform a thorough physical examination, how to collect samples for important diagnostic tests, how to evaluate radiographs, and even how to perform surgery. During the first decade of my career, I became dissatisfied with inadequacies in these conventional options, in particular the failures associated with prescription diets. Little things began happening that opened my mind to a more holistic approach. I learned that holistic is an umbrella term. It means addressing the entire patient, not just assigning a name and a drug to a disease, but rather considering the entire mind, body, and spirit of the patient. There are many modalities which can be utilized to accomplish this goal. A practitioner could be a surgeon or an acupuncturist and still practice holistically. Both might utilize other modalities to complement their primary skill in the healing of that patient. Both might incorporate supplements, better nutrition, and rehabilitation to aid the patient's recovery. Both will need to involve the pet guardians to aid in the healing of their dog or cat. I have learned a lot over the years from my clients and my employees, which was intriguing and very different from what I had been taught in school. This stimulated me to travel the country in search of holistic veterinary education. I have studied under the best holistic practitioners in the world. I became enthralled, gung-ho on holistic. Many modules, many hours of acupuncture, basic and advanced programs. I became certified in 2008. And then there were many modules and many hours of studying Chinese herbal formulas. I also became certified in Oriental food therapy. I traveled to China with my daughter and colleagues to participate with the world-renowned Dr. Shea. He was my acupuncture instructor in Florida. We participated in the first international traditional Chinese veterinary medicine symposium. It was an extremely educational trip. However, unfortunately, my daughter ate from the golden bowl, which I did not, and she became violently ill. The acupuncture alone did not help her. With a fever of 106 and diagnosed with dysentery, she came close to death in a Chinese hospital with appalling conditions. It was the Western approach of intravenous fluids and antibiotics that saved her life. This reminded me as to the importance of integrating the best of Western medicine and Eastern thought to effect the best prevention, management, or cure for a patient. Thus, I have made it my mission to teach pet guardians and colleagues how to integrate green medicine into pet health care. I believe there are 4 basic, easy-to-integrate modalities. These are all especially relevant for every dog and cat, no matter the age, sex, breed, or particular malady of which he or she may be affected. The first of these is to stop excessive vaccinating. In our practice, we have a limited vaccination protocol, and we encourage titer testing. As a special bonus with this DVD is detailed information in a booklet regarding the specifics of titer testing. Vaccine reactions may be rare, but they don't feel so rare when it's your own pet. Remarkably, this little puppy did survive this reaction, and she is currently doing very well. Did you know that vaccine manufacturer inserts say vaccinate only healthy animals? Is a pet with allergies, hypothyroidism, diabetes, epilepsy, arthritis, or cancer healthy? In the state of Wisconsin, it is legal for a veterinarian to issue a rabies waiver for pets who have had reactions or have a health condition which the veterinarian deems may make the administration of the vaccine unsafe. Did you know that a shot does not protect your pet? It's your pet's immune response to that vaccination, and some pets never respond. How do you know if your pet is one who is actually not protected when you go to the dog park, or when you take him to doggy daycare, or to the groomer, or boarding, or to his agility trial, or out hunting? A blood titer test can tell you this. And if your pet's results are very high, he may never need another vaccination, and he may not even need a titer checked again for many years. This can save you a lot of money and saves your pet a lot of unnecessary risk. Whether you are a pet guardian or a veterinarian, you can integrate a reduced vaccination protocol and titer testing easily into your new green medicine protocol, which brings us to our second easy to integrate modality. Feed your dogs and cats like carnivores. Stop feeding excessive processed carbohydrates. Our pets are carnivores. They should not be eating livestock feed. Dry kibble was dubbed dog and cat food during the Depression, when pet owners were starving and could no longer give their scraps to their pet. Dogs began eating leftover livestock feed. So feed producers realized they could capitalize on this by using livestock feed to make kibble, put it in a bag with a picture of a dog on the front. To this day, pet foods are loosely regulated by AAFCO, the Association of American Feed Control Officials. So dog food is not necessarily dog food, and the stricter carnivore felines, cat food, is definitely not kibble. Common sense says our little carnivores should eat prey. In our world, how can we best mimic that? Thus the emergence of grain-free kibble and canned diets, more meat, more moisture, the freeze-dried foods, and especially the prey concept raw diet. And yes, there have been studies done. The Pottinger study followed 900 cats over a 10-year period who thrived on raw diets and died off slowly on processed, unsupplemented food. This was a real food trial. AAFCO trials only require that a food provide for the survival of the study participants for 12 weeks. Your first step toward integrating natural nutrition is to read and understand terminology on ingredient labels. This terminology is based on AAFCO definitions. For example, meat means mammal, animal means mammal. This implies rendered product. Dogs, cats, horses, and roadkill would be considered meat or animal. Therefore, avoid these terms. Look instead for the name of a specific meat, such as chicken, beef, or turkey. And why don't you want rendered product in your pet food? Not only is it disgusting, but for disease reasons, an individual should not consume its own species. Also, I have been to a rendering plant. The dead animals are dumped into the vat with their plastic bags, collars, and tags. Years ago, I read the book Foods Pets Die For. The author analyzed and reported the amounts of toxic heavy metals and poisonous plastic residues found in common processed pet foods. It's sad. And so many pet lovers wonder why such an increased number of dogs and cats are developing cancer. We may not be able to control pollutants in their environment, but we can make an effort to select foods which contain fewer toxins. So don't purchase food or treats which list meat and bone meal. Don't purchase pet foods which list animal fat. Do not purchase foods which contain potential carcinogens, such as dyes or artificial preservatives, such as BHA, BHT, or thoxyquin. By the way, these are still in children's cereals. At the Animal Doctor, we explain nutritional options as steps up a ladder. Now that you know what you're looking for on the back of the bag, you can place your food where it belongs on the nutritional staircase.